And I'm so happy and delighted to invite Donna Rachlin to present. And as you will learn, she also has deep love for the well-being of all women.
Thank you, Dr. Cap. Okay. Hi, everyone. My name is Donna Rachlin. I'm so excited to be here today to talk about menopause and about yoga therapy. I designed an 8-week salutogenic program for menopause, enhancing well-being with yoga therapy, to find out if yoga therapy can be a useful, beneficial, and promising tool for women who are navigating through the challenges of midlife changes. So far, I've conducted 4 programs, all of them in Israel, 3 as IRB research, and 1 in a private setting where the city hired me to conduct the program to its residents at a subsidized cost for their well-being. I'm also very excited to share with you today that the public health system in Israel is planning to incorporate my program in its women's health clinics. This is extremely exciting news. I'm really looking forward to it. So before we delve into the program, I'd like to address the elephant in the room, which is that nobody really wants to talk about menopause. Let's face it, not very sexy, not very appealing, not attractive. Unfortunately, many women don't talk to other women about menopause. You're nodding. I see you. And worse, many women don't talk to their doctors about menopause. Now, according to the Israeli National Association of Menopause, listen carefully, only 1/3 of women report to their doctors about menopausal symptoms. 1/3. Now, why is that? We can only assume that women are embarrassed about their symptoms. We can assume that women believe that there is no relief for their symptoms. And we can also assume that many women don't even realize that what they're experiencing has to do with menopause. Okay, so a conversation like this, can you guys see this in the back? What they're saying, these ladies? Okay, so a conversation like this between 2 friends, candid, intimate, and open conversation about menopause symptoms, that unfortunately doesn't happen often. Women are ashamed. And that's unfortunate because silence doesn't make things any better. It only makes things worse. Now, we've come a long way since the 1960s when women burnt bras in the streets to raise awareness for gender inequality. But what women need to know is that empowerment starts with our health. And I believe that only when we take care of ourselves, when we support ourselves through the entire cycle of women, through all of life circles, only then can we make an impressionable and meaningful impact on our own lives and on the lives of other people. Okay, so it might have been different back in ancient times. Anita Diamond is describing in her book, The Red Tent, biblical times when patriarchal societies existed, men ruled, and women had very little to say. Very little say. They had to say, very little say. Now, despite that, there was one place where men were excluded from. That was the Red Tent. Now, what was the Red Tent? It was a haven for women during menstruation. This is a place where women went to when they had their period. And other women were invited to the tent as well, not men, women. And this is where they spoke openly about womanhood and about sexual intercourse. And this is where they spoke about childbirth and menopause and aging, and they supported each other. And it was a safe place. And it was a place where women received education. and knowledge about menopause. Now, why am I telling you this is because I'm very, very proud to say that the program that I designed for menopause is very much in the spirit of the red tent. Women who participate in the program come to a safe place, a place where they are supported, a place where they receive education and knowledge about menopause, a place where they learn how to cope with menopause changes and symptoms. The good news is the celebrities like Oprah Winfrey and like Michelle Obama are talking openly now about menopause. You know, you see TV, right? This is good because they're helping to remove the stigma about menopause, and that's a wonderful thing. I hope it continues. Okay, let's talk about menopause. I'm going to put this down for a moment. I want to hold it with my right hand. So what is menopause? Menopause is a natural phase in a woman's life when her ovaries stop producing sex hormones. So sex hormones like estrogen and progesterone, okay, and menstrual periods stop. This marks the end of a woman's reproductive years. And this usually happens between the age of 45 and 55. Now, what most of you don't know, and many people don't know, is that menopause is one day in a woman's life. Did you guys know that? One day, okay? The years before that are perimenopause. The years after that are postmenopause. And that whole time can last sometimes, listen carefully, 30 years. 30 years of a woman's life from peri to postmenopause. Now, take a look at the chart on the right-hand side here. Okay, what it says is, for those in the back, is that a century ago, women went into menopause more or less in their early 50s. And they died shortly afterwards because that was the lifespan back then. But today, in 2024, women still go into menopause in their early 50s, but guess what? They live many, many years after that, sometimes even 40 years. So with that in mind, wouldn't you want to enhance your well-being and your health in those years? Nod your head. The men don't have to nod their heads. Michael, thank you. My husband is not moving. You're moving. Yes, you would want to enhance your well-being and quality of life for those 40 years. Yes, you would. Okay, let's move on. I'm glad the guys agree with me. So there are different kinds of menopause. There's the natural biological kind. That's the kind that I just spoke about. Okay, but there are two other kinds of menopause, as far as I know. One of them is called surgical and medical menopause, and the other one is trauma menopause. So what is surgical and medical menopause? The induced premature onset of menopause resulting from surgery, certain treatments, and medications. So 4 participants in the program had breast cancer, had their ovaries removed, and received medication that suppressed hormone production. Now, what these women had to cope with was survival from cancer on one hand, and going into menopause all at once on the other hand. Now, usually women go into menopause gradually. We said 30 years, right? So perimenopause can take maybe 15 years, but these women, they plummeted into aging. Now, the healthcare system is so preoccupied in saving these women's lives, and rightfully so, but then other aspects of these women's well-being are being neglected. That's very challenging, very, very challenging. Okay, let's talk about trauma menopause. Trauma menopause is the premature onset of menopause resulting from physical or psychological trauma. Unfortunately, I encountered this kind of menopause after war began in Israel in October 7th. Women reported to me that they either had menopausal symptoms begin after war as a result of trauma, or the menopausal symptoms they already had worsened. So imagine a woman who's already having sleep problems and is already having hot flushes and night sweats, and is already irritable, and she has mood swings, and she's depressed because of menopause. Imagine what happens when you encounter war trauma. Now, this is a field I'm very much interested in investigating in the future. Okay, so here's a long list of menopausal symptoms. Naturally, I'm not going to read them. But what you need to realize is that some women experience more symptoms than others, right? But all women go through changes in midlife. All women, all of you women, young women as well, all of us go through changes. And some of the changes are simply a nuisance, right? They're just an inconvenience. But other changes can be hazardous to the health. They can be fatal. And for that reason, we have to learn to support ourselves. We need to find ways to support ourselves in menopause as we age. But for that, you need to know your options, right? You need to know your options. Now, one of the things that the program that I designed does is provide options, information about options. So different women can choose what's right for them. How are they going to deal and cope with menopause? Now, one of the options is HRT, hormone replacement therapy, which is highly recommended by doctors today. Highly recommended, but it is not for everyone. Some women choose not to take hormones because they might have misconceptions about it. They might think it can give them certain kinds of cancer or diseases. Other women simply don't want to take anything artificial. They don't want to consume something, unnatural to their bodies. But for other women, it is simply contraindicated to take hormones. It could be fatal to their health. If they have a family history of certain kinds of cancer, they just simply can't take it. So if you're not going to take hormone replacement therapy, you need to find another way to support yourself in menopause. And this is where complementary therapies, such as yoga therapy, come into the picture. Okay, so knowledge and education about menopause is very, very important. And this is why I put a great deal of emphasis on it in my program. And I'll explain by giving a couple of examples. I think you'll enjoy them. Okay, so the first is a woman who participates in the program learns that in menopause, there's tissue dryness. Did you guys know that? Vaginal dryness, everybody knows that one, right? Nobody talks about it, but everybody knows about it. And you also have tissue dryness in the eyes and the mouth and in other places of the body. Now, when you have tissue dryness in the mouth, it changes the pH balance, which means it can lead to gum disease. Oh, you're nodding, Dr. Chappell. Okay, this is good. I'm getting the guys engaged. I'm so excited. Okay, so if a woman knows that she can get gum disease in menopause, she can choose to visit the doctor, the dentist, more often to prevent gum disease. Here's another example. A woman who participates in the program learns that in menopause, there's bone density decrease. It can lead to a disease called osteoporosis. That's right, osteoporosis. Now, a woman who knows that, who learns that in the program, can decide to make lifestyle changes in menopause. What can she do? Consume calcium, exercise, that's right. Maybe even take a bone density test, which is called a DEXA test. All this, again, to prevent disease, Okay, here's another really fascinating aspect of why knowledge in menopause is so important. Many women are being misdiagnosed by their doctors, confusing their menopausal symptoms with other symptoms from other medical fields. Now, an orthopedist that I spoke with about the program was surprised to learn that lower back pain is a common symptom of, do you know? Pelvic floor prolapse, which is a common symptom of menopause. If a woman presents unexplained back pain and her tests come back negative, she should be referred to a gynecologist. That orthopedist needs to know to refer her to a gynecologist to take a look what's going on in the pelvic floor. Okay. Okay, so speaking about preventing disease, salutogenesis, which is in the title of the program that I designed, according to the dictionary, it is the promotion and maintenance of physical and mental well-being rather than disease, with particular emphasis on the coping mechanisms of individuals which help preserve health despite stressful conditions. Now, can you guys in the back see Robin Williams, the late wonderful Robin Williams, in the role of Dr. Patch Adams, practicing salutogenesis? And this is what Dr. Patch Adams says in the movie. When you treat a disease, sometimes you win and sometimes you lose. But when you treat a person, you always win, no matter what the outcome is. Okay, so the goals and the objectives of the program. The first one is to provide a professional and safe environment for discussion. That would be the red tent, right? That would be the red tent. The second is to offer an educational platform to receive knowledge about menopausal symptoms and solutions with valid and up-to-date information. So this is an educational program. It provides knowledge. Okay. The third is to learn practices which draw from yoga therapy and that aim at tending to menopause symptoms and alleviating them. And the fourth is to offer coping mechanism through lifestyle changes and proper attitude, what we call in yoga, pratipaksha bhavana, right? It's cultivating attitude towards situations we have very little control over. Okay, there is evidence-based benefits of education for menopause, which I go into in the thesis that I wrote. Education about menopause helps women to make informed decisions about their health. There is also evidence-based benefits of yoga therapy for menopause. Research shows that yoga can help in alleviating some of menopause symptoms. And that too, I go into in my thesis. Oh, this is my favorite slide. Take a look. This is the program. I'm so excited about it. You can tell, right? This is the program. There are 8 weeks, 8 weeks. We meet once a week for 2 hours. Okay. Every session begins with a discussion, usually with a PowerPoint, about an aspect about menopause. And that becomes the theme of the day. And then I instruct and we practice practices from yoga that are within that theme. So I thought it would be a good idea to give you a few examples. They're really nice. Look, on the first week, we discuss hormonal roller coaster and mood swings. And on that day, we practice mantra and pranayama for mental and emotional regulation. We practice some other things, but that becomes a main practice in that day. On the second week, we discuss hot flushes and night sweats. And on that day, we also practice Shitkari and Shitali pranayama, which, as you well know, are cooling practices. On week 3 and week 4, we discuss musculoskeletal changes, such as sarcopenia, which is loss of muscle mass, and osteoporosis, which by now you know is decrease in bone density. And on those 2 sessions, we practice asana, which focuses on strengthening the big muscles of the body, right? Because they support muscle and they support bone. But when you strengthen the big muscles of the body, it produces myokines, which support cognition. So not only do we address bone and muscle, we also address cognition in menopause. On week 6, for example, we discuss decrease in memory, and then we have a wonderful, wonderful practice with visualization and asana focused on coordination and movement memory. I wish I could show you how it's done, maybe another time. It's really exciting. And on week 7, for example, we discuss decrease in sex drive. And on that day, we practice chakra meditation focused on the sacral chakra, Svatisthana chakra, and asana focused on the pelvis. This is a nice program, right?
Yeah.
It's nice, yeah. Okay, so what is the methodology that I use in the program? Movement, breathing, meditation. We also discuss dinacharya, which is daily routines and lifestyle changes. We practice mudra and bandha and mantra, and we have beautiful conversations about yoga philosophy. For example, when we discuss the klesha, 2 out of the 5 klesha, raga and dvesha, how women in menopause attach to their youth and averse getting old. That happens to men as well, but you know, I'm not concerned with men, only with women. So
Thank you very much.
somebody else is gonna have to take care of the men. I just deal with women. Okay, so what is the assessment tools that I use? One of them is the menopause rating scale, the MRS. The other one is the brief resilient coping scale, the BRCS. And those 2 were to compare pre and post program scores. Now, at the end of the program, I distribute to the participants a self-reported questionnaire to provide feedback on perceived benefits from the program. And the results. Okay. The MRS and the BRCS, believe it or not, revealed no significant difference between scores before and after the therapy intervention. So you're like, what is she so excited if there's no change in the program? And I'll explain. Listen, this was not surprising because I did not intend in only 8 weeks to see menopausal symptom changes. It's just too short. And regarding the brief resilient coping scale, the participants who participated in the program were already a high resilient copers before and after the program. So having said that, here are my wow results. Check it out. The benefits revealed in the self-reported questionnaire were unbelievable, were amazing. I tell you, unbelievable, and that is what motivates me to continue conducting the program to as many women as I can, anywhere, anytime. Let's see what the women reported. Are you guys listening? Okay. This is life-changing. This is not it, it's life-changing. Oh, time? Okay, I'm done. I have 2 more slides. We're good. So one of them is, I can go fast because you understand. Increased quality of life, yes. A positive shift in attitude and coping mechanism, yes. Lifestyle changes that support physical, mental, and emotional well-being in menopause, yes. Increased sense of empowerment and self-efficacy, yes. A new comprehension of menopause through lenses of yoga therapy, reported by the participants to be, listen carefully, a meaningful and transformative experience and motivation to continue practicing yoga after the program. And here I'd like to conclude, guys, with a quote by Mira Artzi-Padan. She's the founder of Yoga for Women in Israel and my teacher. And this is what Mira says about menopause. Every passage of time requires us to employ new tools we hadn't used before, to learn something new about ourselves and about the change imposed upon us, so that we may adapt ourselves to the new era and stand within it. And on a positive and final note, here is what Michelle Obama said about her menopause experience. She said, the changes, the highs and the lows and the hormonal shifts, there is power in that. Ladies and gentlemen, thank you so much for your attention. I hope you enjoyed that.